Hi there, and welcome to an overview of some of the major stages of inflammation. Now, inflammation we often think of in negative terms, but in the short term, it actually is a very beneficial process, and it really helps with invading microbes that are coming in and helps kind of slow down or halt infection to some degree. So it helps attract the immune components that are there. And that may be bringing over platelets or maybe bringing over white blood cells, so it kind of attracts them to the area. It also helps to repair the area as well, which is important in the injury I've shown you here, and then remove the microbes as well. And then in addition to removing them, the ones that do remain there, helping to destroy them, again, by attracting the white blood cells over that could phagocytize them, and then prevents their spread, ultimately. That's really the ultimate goal that's there. So I've shown you an injury here, and so this is just kind of a puncture wound here. Microbes are introduced, and keep in mind that you will go through this process even if this were something sterile. It probably won't be as exaggerated because there won't be some of the microbe stimulators to kind of ramp up the process. But even if this were sterile, you'd be going through some stages of the inflammatory process. So initially, the vessel is going to narrow, or what we call vasoconstriction. And that's just kind of an initial sealing off of the site. But very quickly, that's going to change over. So there are specialized cells called mast cells that secrete histamine. And many of us know of histamines because we take antihistamines when we have kind of chronic or seasonal allergies. So histamines serve to help basically now open these vessels back up and increase permeability, which we do need in inflammation. Of course, when we're having an allergic type issue that's going on, where we're having runny nose, itchy eyes, that sort of thing, that becomes kind of irritating. So we take antihistamines to work against that. So moving on to stage 2, and I do want to list here before I move on, in addition to that, you're going to have what's called chemotactic factors, and that's kind of a big umbrella term for chemicals that will help attract over the white blood cells. So we're having this initial kind of close down response and then a release of chemicals in the early stages to basically stimulate the immune system and get it ramped up and quickly get it responding to the injury. So going back, we're going to remove our nail. We're going to assume that we've pulled that out, I hope. And get our microbes. So initially I mentioned we had vasoconstriction. Well, now we're going to switch over to vasodilation. So we're going to open up those vessels. And due to the release of some of these chemicals over here, we're going to have a movement of white blood cells to the area. So neutrophils are often shown, so it could be other phagocytic white blood cells. And they're kind of rolling along. I usually show them kind of moving along the vessel here, but then they need to kind of stop at a specific spot. And that's where these chemicals will help attract the cells to the right location so it doesn't just kind of roll on by and pass the microbe up. And so this first step of kind of sticking is called margination. Okay, now there's going to be a squeezing effect. So when we have this opening here, there's actually, even though the whole vessel as a whole is opening, there's some constricting right at the wall level, not to each other, but kind of pulling apart. And that's going to allow these white blood cells to start to squeeze through. I'm going to draw it over here. Some of these openings. They're flexible enough that they can do that. So you might be looking at that circular shape and then the shape I have here and say, wait a minute, how is that possible? So it will actually start to squeeze through. And I'm getting pretty far away from my injury here, so we're going to assume the microbes are all along here. So it can get to those microbes, so it gives them access. And this squeezing is called diapedesis. And that allows them to arrive to the area and start to phagocytize the microbe that's there. So hopefully these are starting to already take those up and destroy those. So that's kind of the idea that's there. As this is happening too, you're having fluids that are building up in that area. So that kind of takes us on to the next step. And even though I'm kind of drawing these in discrete, distinct steps, keep in mind that the fluids are constantly moving into that site. So it's kind of a little bit all happening at the same time, but we can kind of identify some specific phases. So going back to our skin and our injury, hopefully we've started to really clear out some of the microbes that are there with the white blood cells. We're going to be optimistic and say those are being largely being phagocytized. These are our white blood cells. And so neutrophils are often shown there because they're one of what's called often the first responders that arrive to the site. As that's happening, you're having a fluid buildup. And so we're quite familiar with this with even a minor injury. So, a sticker or a paper cut, a sticker in the foot, something like that. You're getting that kind of swelling and pain that's there. And so what's happening is all this fluid is kind of starting to fill the space up that's in there. Now, ultimately, you want that release. And this is where chronic inflammation can be a problem if that fluid remains, because you're going to be in a situation where you're going to have stiffness and pain and swelling that's continued. So you're hoping this is a fairly short term. We're still going to have our vasodilation. This fluid buildup is referred to as edema. And again, that can be on a fairly small scale. You can have a much larger event of edema where you have major swelling and pain. So it just kind of somewhat relative to the type of microbe and then the degree of the injury. You can have a buildup of pus. Sometimes you just get that clear fluid, the serous. Also as well, sometimes you can get a fibrin buildup. Because it's enmeshing the microbes as well. So it just depends a little bit on what the necessary response is. So pus, we would see, in a skin injury, it's kind of this yellowish, sticky substance. The serous is more of a clear fluid. And then also with some injuries too, you would have blood moving in there. Just kind of depends on the injury itself. And then finally, you have the last step, which we all hope to get to, and that is sort of the repair and resolution. So the skin is repairing. Of course, you may get scab formation there, and then scar. Blood vessels return to normal. And then these white blood cells are either dying off or leaving the area that's there. And one of your later responders that you're going to have at this point are going to be your lymphocytes. And remember, those are your kind of the late arrivers, B and T cells. And part of the reason for their late arrival is that they have to be selected and then stimulated so that they can get the correct type of B and T cell to that area that's there. So they're a little bit, so they're going to really help kind of on that last stage of picking up any microbes that maybe weren't phagocytized or were missed in that. So they're going to respond to that. So several tiers here of response that are going on. Hopefully the macrophages are returning back into the system or dying off. Remember, if you have a major die-off, that you'll often see that as a pus buildup as well. So just a couple things I want to mention, just kind of wrapping up, that this is facilitated by a whole list of chemicals. But the big category, we can put them in our chemical mediators. So they help stimulate the process, and then hopefully they kind of go away and the process dampens back down again. So I mentioned interferon, which will stimulate antiviral proteins in many cases, interleukins, which will stimulate various white blood cells, including the B and T lymphocytes. There's different subtypes of that. Then there are chemical mediators that play a role in the vasoconstriction and the return, like prostaglandins and histamines. And then there's a few other in there as well. And there's also, sometimes these are put separately, sometimes they're put together, because chemical mediators, kind of sort of a big category that you have there. They are help to also help as well with the helps with the process in terms of getting the right types of white blood cells over to that area that's there. Okay, I think that's all I've got on that. Yes, so they'll help with stimulating the white blood cells. So just remember, with inflammation on a short-term level, we're looking at kind of an immediate response of sealing off the area. Then we're actually opening up the area, allowing the white blood cells to move to the area, do a process called margination, and diapedesis. And because you are secreting all of these chemicals, you're going to ultimately get fluid buildup, and that has to do with these chemical mediators and cytokines building up. Also has to do with the white blood cells perhaps dying off if they're doing a lot of phagocytosis, and there's a lot of activity as well. And then finally, you have this healing, that scarring or scabbing. And keep in mind, you may also see fever with this process, kind of as a supplement to that. And with fever, some of these factors that are released will actually signal other chemicals in the body called pyrogens to help raise, we call it the thermostat in the hypothalamus of the brain. And so that can be going on. You may not get that with a paper cut, a very small injury, but if it's a larger inflammatory response, that can be then another piece of inflammation as well. Okay, that's all I have on this. I thank you for your time, and please let me know if you have any